Hi, Dr. Ramsey Choucair. I'm a board-certified plastic surgeon in Dallas, Texas, and today we're going to discuss another educational video topic, how we assess the aging of the brow and the upper eyelids. Well, there's three things we look at when we look at the aging of the upper eyelids and the brow. First is there any droopiness of the eyelid? Because that's completely separate than really aging of the skin or the brow. That's where when you open your eye, you notice at the end of the day, the eyelid starts coming down almost to half mast. In other words, the muscle that normally opens and closes the eye is stretched out and your eyelid hangs low. That's a totally separate non-cosmetic issue, and you first have to rule that out. Even though it's not common, it does happen, and that's called ptosis or droopiness of the eyelid. The second thing we look at is the eyebrow in a good position? Because if the eyebrow's in a good position, then there's really nothing to do to lift that or change that. And in most cases, the eyebrow position is appropriate. So that leaves the third thing we look at, which is the most common thing that's done to rejuvenate an upper eye, and that is excess skin or fat in the upper eyelid that can hang down or make you look a little tired or a little teary-eyed. So those are the things we look at: the eyelid itself and whether it hangs, the brow position, and the upper eyelid skin, which is the most common thing we see. And the fix for the upper eyelid skin is usually one of the easiest things we do in the face. Usually requires local anesthesia with a little sedation. Usually patients are home that afternoon reading and doing what they want to do, and the only reason they don't go to the office for 5 to 6 days is just because they could have a little bruising and swelling around the eye. So I hope that helps you know what we think about when we talk about rejuvenation of the upper eyes.